Time now for this week's medical moment. The U.S. seen a rise in COVID hospitalizations and deaths due to the contagious Delta variant of the disease.
Health officials are also noticing that the Delta symptoms are a bit different than symptoms people experienced last year and earlier this year.
And we're joined today by certified family nurse practitioner Pam Taylor from USA Health. She's here to discuss the symptoms associated with the Delta variant. And maybe first you can just tell us, how are they different from the previous symptoms of COVID?
So the symptoms are similar. We do have a couple new symptoms that we have now added, or the CDC have now added, and that's nasal drainage and nasal congestion. So the symptoms still apply: the shortness of breath, a dry and frequent cough, nausea, vomiting, diarrhea. You may have a headache. You may lose your sense of smell or taste. So the newer symptoms is nasal drainage and nasal congestion.
Yeah, in fact, I know a few people who have the Delta variant, and those are the exact symptoms that they started complaining about, the nasal drainage. So what symptoms should prompt people to actually get tested for COVID-19?
So any of those symptoms that I just mentioned should prompt anyone to get tested for COVID-19. The signature symptom is if they lose their sense of smell or taste. If they can't smell or taste anything, those are like our classic symptoms that most patient comes in to get tested and they test positive for COVID that they have. But any of those symptoms that I mentioned earlier, any of those symptoms are symptoms related to COVID-19.
A lot of people say, look, I've already had COVID, I've got antibodies or whatever, I don't need to get the vaccine. Can you respond to that?
Yes, I can. So if you've had COVID-19 before in the previous month, we have a new strand that is here now, the more dominant strand or the dominant strand, which is the Delta strand. So the COVID that you test positive for in the months previously or before, those antibodies does not protect you from the new strand, the Delta strand. So you still need to, get your vaccine, and you still need to come in and be tested for COVID, regardless if you've had COVID before in the past.
All right, Pam Taylor with USA Health. Thanks so much for joining us tonight.
You're welcome. Thank you for having me.
Well,